Hello, dear friends, and a very warm welcome to all of you this evening, joining us from Kenya, across Africa, from different parts of the world. We are so glad to have you with us this evening for DTLC Season 13, Week 4. So first, on behalf of the DTLC team, we want to say a very big thank you. We have now reached the 1 month mark, and your commitment and participation have truly been encouraging. The energy in the WhatsApp group, the questions, the meal photos, the active participation during the sessions, and you've really motivated us as a team. You are giving us the motivation to actually give you even more than what we had planned. So please keep up this beautiful energy. We truly appreciate. Now, before we begin, here is our Did You Know for today. Well, did you know that two people can eat the same food but different portions and experience very different blood sugar responses? That is why diabetes management is not only about what we eat, but also how much, when, and how we combine foods on the plate. So tonight's session is therefore very important and very practical. Our focus this evening is food portioning, hypoglycemia, and hyperglycemia. Well, portions have been one of the most common questions in the WhatsApp group this week. How much of this? How many should I? What does a balanced plate look like? Well, tonight we are finally here. So let us pay close attention because this session will help us move from guessing to understanding. We are also going to discuss hypoglycemia and hyperglycemia. For those living with diabetes, you may have experienced some lows, some highs with your blood sugar before, but tonight we get to understand what this means for us. Of course, to lead us, we have our dear doctor, diabetes specialist, Dr. Jalang'o. Well, this evening, we are honored to have with us our cherished participants, our dedicated DTLC team, and our special group of interns who are joining us to learn and work alongside this big DTLC family. So we warmly welcome you. We also sincerely appreciate Dr. Ojwang, our registered dietitian, Ms. Jalang'o, diabetes care specialist, for their continued commitment to guiding us through this journey. So please get comfortable, get your notebook. Feel free to post your questions in the chat. We will respond to them as we move along. So to begin, we would like to start with two very important reviews. Well, the first review, we'd like to talk about blood sugar monitoring. We've sent you the forms. Have you been monitoring? Well, we'll invite Dr. Ojwang to lead us through this discussion. Welcome, Dr. Ojwang.
Good evening, everybody. Thank you for being here. And please remind your friends, your family to come here and let's learn together. Dr. Jalang'o, would you like to join me for this session? So this is just a reminder about blood sugar monitoring and knowing your numbers. Remember, we have to know the numbers for us to be able to make changes. You know, when you take your food and you take your blood sugar 1 hour after meal or 2 hours after meal, you'll be able to see, are you doing better? Are your sugars dropping? Are they higher? So really very, very important for us to actually monitor our numbers. So there's one person who sent me a chart and I gave feedback, but they only monitored their fasting blood sugars. Fasting blood sugars are good, but it's not the only one. It's not the only ones you need to measure. This is because diabetes is a condition that affects the way your body uses food for energy. And so you need to know how high does your sugar get after a meal and what types of food actually trigger your sugars. Over the years, I found that people have different triggers. You find somebody who eats something very healthy like whole brown rice, but it's a trigger. So their sugars actually go very high. Even if they take normal portions, it goes very high. And you cannot know that unless you actually monitor your sugars. And different people have different different triggers. It can be wholemeal, it can be white bread, it can be brown rice, it can be anything. And that's the only time we recommend that somebody living with diabetes can actually eliminate something from their diet. So let's hear from the doctor. Why is it important to actually monitor these blood sugars?
The blood sugars are extremely important.
Oh, sorry, you're muted.
Thanks, Alice. Good evening, everyone. Blood sugars are important because it is the blood sugars that will tell you whether the things that you're doing, meaning the interventions, your lifestyle changes, your food that you're eating, the portioning, whether it is working or not, whether your exercising is working or not. And then the blood sugars are also important because sometimes they're the ones which let you know when you're going off course, when you're going either hyper or hyper. So the blood sugars give you a direction, which is extremely important for this long journey that you take with diabetes. And especially if you do not get remission, it is important to keep tabs of your blood sugars daily if possible, because it provides very, very important informations that helps you adjust your diet, helps you adjust your exercise, your lifestyle, like sleeping, exercising, etc.
Yeah, thank you. Thank you very much. And somebody also asked me, I'm not living with diabetes.
Yes.
Should I be in this session? Yes, this session benefits everybody. But last season, was it season 11? We encouraged everybody to go for their blood sugar check because some people, we don't measure their blood sugar. We don't measure our blood sugars. And actually, when she went to check her sugar, she could not believe it. She was confirmed that she's been living with diabetes. Her HbA1c, which is a classification for blood sugar control for people living with diabetes, which is considered taken after 3 months, it was very high. That means she had actually been living diabetes for maybe 3 years. She was not getting the symptoms. So if you've never checked your blood sugar, if you've never checked your blood pressure or cholesterol, this is a very good time to take this test. Okay, so thank you, Dr. Jalang'o. But we also have one of our DTLC participants who is living with type 2 diabetes and is a medical doctor and is going to share his experience on what he is doing. And I hope this is going to encourage you. Dr. Habel Alwanga, you're welcome. I'm just going to add you here. Yes, then we
Yeah, thank you. Thank you very much, team. Yeah, so I think I'll try and just take a few minutes. And good evening, good morning, or good afternoon, everyone, wherever you are. Yeah, like you heard, my name is Alwanga. I have been living with diabetes for the last about 3 years, 2 to 3 years, and I just I've been trying to join this program, but I think, like I told Dr. Jalang'o, Dr. Ojwang, that I kept on, what is it called? Procrastinating. Yeah. But then here I am. I think I joined, and I'm not basically regretting it. So I think I'll just share my what I did for the last, I think it's about a month or so. And I think I really want to thank the sessions we've had, one-on-one that you've had with Daktari. So this is just showing, I've been trying to monitor my sugars from the 15th, and just like you can see, the well, let me start off with my HB1C. I think I did some lab work sometime, I think earlier this late last month, and you can see it was about 8.1 there with the high cholesterol, but then the rest of the other things were quite okay, including the LFTs, liver function tests, and the UECs. So I've been doing my sugars, and I'll just take you through these. You can see where we were. Basically doing the highs for fasting and even pre-dinner and the like, and even 1 hour before, after breakfast. I think one particular day I was able to do that on the 15th, and you could see actually in the morning it was quite high. And just to show you the effect of exercise, I actually took it after a 5 kilometer walk. I do my walks in the morning mostly just to hit the numbers. Then I'm able to, when I'm walking, doing other chores either at work or wherever, I'm able to now walk around to make up to the 15,000 mark or something. So you can see it dropped by about 0.8, but that was still high. On breakfast, 1 hour for breakfast. I think this day was quite a bad one for me, and I think I guess why. One of the things that I think has been mentioned is the triggers. Banana. I think for me, bananas are really, and these were boiled bananas, really a bad thing for me. And even in the past, last year and the previous years when I was doing that, so you can see these were pretty high here. And then boom came I think we had this session on carbohydrate intelligence. I think that for me was a game changer. Basically getting to do one carbohydrate per meal, and I believe now today we're going to look at portions that will even make it better. So you can see what happened with time. We've had quite some reduction. So you're moving from the highs towards raised, for the pre-dinners, 2 hours after breakfast. Okay. So then we go into a fastings, I think by 19th, again, about 7 raised. We go into, I think this was now the post, the sessions we had on carbohydrate intelligence. So you can see we are going towards greens. And I think for me, it was really impressive. I was even telling Dr. Ojwang at some point, I really got excited. I think this was the first one I did. And I was like, wow, it works. So I looked at one of the things I was struggling with. Remember, I think week one, we were told to look at some of the things we really need to do away with. Snacking for me. That's something I've really, I was really doing, but I've cut off that almost completely, so that at least just have that out altogether. So you can see we are moving from the reds, basically, if you're to use the raster colors in that, for that matter, moving towards the green. So for me, I think it's a journey. I guess things will get better as we move along. And maybe just the last one on blood pressure again. Yeah, I think there was a time my pressures were quite bad. I think that time I was not taking drugs actually, and I basically wasn't exercising as much. Then I got into I think there was a challenge, a 5 kilometer no excuse challenge by every day, and that really helped me. So you can see with time again, courtesy of this, we've moved again towards the good side of our blood pressure monitoring. Yeah, so I think that's what I just wanted to share as per my discussions that I've had on our weekly one-on-one sessions. And for me, it's just to encourage all of us that it's doable, and it's something that you can actually, because I know, I'm aware that I have 2 friends actually who went into remission, and for me, they are really an encouragement for me on that front. Thank you, and back to you.
Oh, well done. Thank you so much. But I have a question for you. What did you tell me? What other thing really improved your blood pressure?
Yeah, the other one was exercising was because I think I've really been out on moving around. I think you can see that on my whatever, that at least I really try to move around and at least ensure that, you know, I'm able to exercise a lot, to make myself active, quite active. Yeah.
Okay, very good. What did you say? Also, animal protein. Are you having animal
Ah,
protein?
yeah, yes. That's like, yeah. That is profound. Thank you for reminding me that. Yes, I think it's, and I saw this on a particular day. I think there's a day, I think 2 days, where I think I found myself taking animal protein in the evening, and of course my pressures went up. But the days when, you know, I just cut that off and take veggies, actually the pressures were quite within normal. And thank you for that reminder. Yes, certainly
Okay.
true. Asante sana.
Oh,
Yeah.
we want to thank you so much for sharing your experience. And as a medical doctor, what would be your last words to everybody? And we are so proud that you can join a session led by a dietitian, and then you can also share your experience. So what can you tell everybody who is part of this program?
Yeah, yes, I trained as a medical doctor, has been said, and I think one of the things that was mentioned earlier on is that for us doctors, we're not taught about preventive or nutrition per se. If I still remember my whole 8-week course, and you know, we never got to see it again. So we just taught about, you know, something, a disease is coming, you need to, you know, go ahead and treat. And I'm sure the same thing would happen if you walk into, you know, into a physician's office. Your sugars are high, your pressures are high. What will happen? They will just give you the, you know, keep on
Medicine.
bumping the, you know, the doses up or changing the drugs. So for me, I think this DTLC program is a game changer, and we can actually, I think we'll all benefit from it if we keep up to it. And I think I've just shown part of that evidence here. Thank you.
Oh, thank you so much. So we have somebody whose hand is up, eh? But please, can you name yourself? At this moment, you're called Galaxy S9. Please go ahead and unmute and speak. Okay. You're unmuted. Please go ahead.
Yes, I've unmuted. Dr. Alice, how have you been?
I've
My
been
name
well,
is
thank you.
Jane Sigu. I was in season 7.
Aha.
So
Welcome
I'm
back.
very
Yes.
happy. In fact, your program really helped me. To date, if I walk less, it's 10,000 steps every day. And
Wow.
also, you remember during my participation in season 7, I managed to score on recording my diabetes every day. So
You are the highest. I
yes,
remember. Yes.
I on recording. I still record to date, and I thank God. In the morning, I can have 4.5, 4.7, 4.3. If it is much, it is 4.9. I've benefited. 2 hours after 1 hour after the meal, it can be at around 7. 2 hours after the meal, it can come down to 6 again. I take a lot of water. That is what I can encourage people. And at night, I've stopped taking carbohydrates. I've stopped taking any animal product. I just take vegetables. So that is the advice I can give. And even carbohydrates, if I have to take, I'll stop at exactly 3 in the evening. Beyond that, I don't take carbohydrates.
Wow. Well done. Thank you for coming back. And this is season 13. So you're here and she's still going strong. Thank you for sharing. We are very encouraged by your experience. Thank you very much. And of course,
Welcome.
also encouraging people. She did, it was 422 pricks over 12 weeks. You know, she measured her blood sugar every day. She won the award. So thank you so much for being here. We appreciate it. Yes. I see people have asked question in the group. I see somebody says, explain the protein. But we also know some people have just joined the program because the last week for joining was end of last week, like Friday. So now it means if you're asking this question, you have not watched session 1, session 2, session 3, session 4. So allow me not to answer this question today because we have a packed program. But what I want to encourage you, please watch the sessions and then ask the questions in the group on YouTube, on Facebook. We will post the answers there. Thank you very much. And thank you very much, Dr. Habil Alwanga. We really appreciate your encouragement. So, are you going to monitor your blood sugar? We are very many in the group. We are very many. We are over 50. And I have only received one person sending me their feedback. So, are you scared? What could be the issue? Don't be scared. We are not judging. We are just helping you understand your sugars so that you can improve. We can show you how to improve. We can help you to understand the numbers. Remember, the diabetes person who knows more lives the longest. So when you know your numbers, you will be doing very well. Yeah. So over to Lydia. Lydia, was there any question that was really burning that we needed to answer apart from the one for protein? Okay.
Yeah.
There's something on water.
Kuda just got the link. You can just post the sessions here. It's on YouTube. So we'll post the link here. Don't worry, we'll take care of you. Okay? Okay, very good. So Lydia?
All right. Well, thank you so much for the review. Monitor, monitor, monitor. What gets monitored gets managed. And of course, we would like to extend our sincere appreciation to Dr. Alwanga for generously sharing his personal journey with us. So have you participants noticed somebody who goes up to 35,000 steps? That is Dr. Alwanga. So thank you so much. Your story is a powerful reminder that this is not just theory, it is real life. The program is working. Thank you so much. So moving on,
Yes.
we had an eye-opening session last week, carbohydrate intelligence. How are we doing? Are we becoming more aware of our carbohydrate choices? Well, Dr. Alice is on standby to review this with us. Welcome.
Thank you very much. I would like to hear what you thought about the carbohydrate intelligence. And I can say this group during the carbohydrate intelligence session, you were asking questions, you were talking, which was very good. In the past, all the 12 sessions, when we do the carbohydrate intelligence, everybody goes quiet. Nobody says anything. It's like they're angry. How could you say that? So you guys were better. So what did you think about it? And what have you done? Questions would be good. Yes. Okay, good. But maybe what I can do, I want to just share 1 or 2 meals from last time, like a quick we go. So for those who are joining, carbohydrate intelligence is just really knowing your carbs. What is carb? Many people know that carbs are starches, but no. All fruits are carb, legumes are carb, dairy is carb. And when we eat 2 portions of carb in a meal, it's bad for you. And so we did some analysis last time. So I'm just going to share, I'll share the slides and then I'll share how you're doing. Oh, what happened? I can't see my share. Sorry. Oh, there we go. Yep. Okay. So you can see this is just, this person had double carbohydrates. So they have fruit is carbohydrates and bread is carbohydrates. And so they had a total of 13 teaspoons of sugar. But I'll just keep on to, yes. So you can see this person had 3 types of carbohydrates, okay? They had some legumes, they had some bread, and they had rice. And this is equivalent to taking about 14 teaspoons of sugar. And you can see they had potatoes, they had fruit, and they had maize and beans. So this is also triple carbohydrates, 11 teaspoons of sugar. This is double carbohydrates, okay? Or triple carbohydrates. You have fruit, you have rice, and you have beans. When you remember, carbohydrates become 100% sugar. So when you take carbs, all carbs in your meal, it means the amount of sugar your body producing is a lot. It will require a lot of insulin or a lot of medication. And it doesn't matter whether you're living with diabetes or not. You have to change how you eat, because if you're not living with diabetes, you are soon going to be diabetes, because the demand on the insulin is very high because of double or triple carbohydrates. So what we are recommending, you should eat one. So these were the plates. They were very common. You can see almost every plate had a double carbohydrate. Okay, so now let me show you how you're doing. I think I am very happy. Dr. Jalang'o, have you looked at the pictures in the group?
Yes, some tremendous changes. Yeah, I've seen a
Yes.
lot less carbs than the other week.
Yes, yes, yes. So, and thank you for posting, because when you post, then it helps us to even have this presentation so that we can share with you what you're doing. So, and this presentation is always done by nutrition intern, our nutrition assistant, who is Nemali. Yeah, thank you, Nemali, for doing this, and thank you for your post. So, this is. Can you see the slides?
Yes, we can.
Okay. So this is the plate for the week. So you can see in this group, we don't have double carbs, okay? We don't have double carbs. So well done, well done. And you can see here, I think this is a picture from last time, we've just seen it, okay? So we can excuse that picture. You can see this one is a new picture. We had rice and we had French fries or chips. So we want to avoid double carbohydrates. But you can see there's good trial, even though I'd like this person to have less of this brown ugali and then more vegetables, but still no double carbs. This looks like double carb, but sometimes you're also mistaken. So it's good to write exactly what you're taking. You see, this is carbohydrate intelligence. Even though she had 2 carbs, she had a cookie and some strawberry. The portions are small. And this is great. This is good, okay? You can see we have no carbs, no double carbs, okay? What I'd like to see is more vegetables. You see, I think this is double carbs, eh? We have beans here, and we have ugali here. So that's double carbohydrates. So if you're still doing this, if you haven't watched the carbohydrate intelligence portion, I would highly recommend that you watch it. And remember what Dr. Luanga said, it's a game changer for him, and it will be a game changer for all of us if we do that. So I'm still having double carb. We have bread, we have oats, okay? This is double carb. You can't eat like this. In fact, this is really a large portion because nuts are also high in protein and fat. So when you look at calories, this is high. So you want to always have some vegetables with your meal. It's a good meal, but it is very dense. But then we have double carbohydrates. So that's not good. And so this is a good meal also, so most of the meals, yeah, so we don't want to be eating just like fruit and yogurt. That's double carbohydrates. That's double carbohydrates. Because if you have that for breakfast, how long are you going to last? It's just going to raise your sugars, and then you're going to be hungry. Then you're going to crave for carbohydrates, then again. What we recommend is to take your animal protein for breakfast because it lasts you for 6 to 7 hours. And then avoid it at night because it reduces the quality of your sleep, increases your glomerular filtration rate, which increases your blood pressure. So animal protein is better. So learn to have a meal for breakfast. If you have yogurt and nuts, that's a good meal, but now if you have fruit, yogurt, nuts, that's 2 carbohydrates, which is not good for you. So generally, I think everybody has tried. What I also want to encourage is some of them, the reason I've highlighted is because you can see this is a good amount of vegetables, but also a good amount of carb. So the portions control session will be, I think, beneficial. But well done, everybody. Well done on your posts. Okay. So we are a work in progress. We are just in week 4. Now imagine when you're in week 7, 8, those sides. Eh? So well done, well done, well done. Yeah. Okay. So we can take a question. Otherwise, where's Lydia?
There's a question from Linda.
Yes, please.
In our facility, patients are usually told to come for clinic before eating anything so that their FBS is taking. That's fasting. That it tells more story about the blood sugar level. But in the previous sessions, I believe here it was mentioned that RBS is preferable. Kindly help me understand this.
Dr. Jalang'o, go for it.
Yeah. Actually, your most beneficial sugars are not called RBS, they are called postprandial sugars. Sugars that are taken after you have eaten. Now, you're taking medication, you're doing interventions so that your body can handle your food better. Now, if you take a fasting blood sugar, fasting is an abnormal state. You have not eaten anything over a period, often more than 8 hours by the time you come to the clinic. Now, does it give a true account of how well your blood sugar is being handled by the interventions? The answer is actually no. So the best indicator is usually the sugars taken after meal. If your body and the interventions that you're taking into your body, you're exposing your body to, are work sugars are usually your answers. And usually, if you have sorted the post-meal sugars, I can bet you the fasting blood sugar is okay. But you can have very good fastings and yet your post-meal sugars are not good at all. So we ideally would prefer your postprandial blood sugars to assess your level of management.
Thank you so much. And also, we want to help our patients to monitor their blood sugar. So when they come to the facility, they have a record of their readings, and we're not just dealing with the one fasting blood sugar, because one reading of fasting is not helpful for management. And this is why we encourage everybody to monitor, have several readings in a day, especially when you start to be managed. And then once you understand your sugars, then you'll know when to take the sugars. So one sugar is never enough. One blood pressure reading is not enough. We need the clients to make readings. Then we can use that to educate. And with the food, remember Dr. Alwanga's data with the food. So you know which food is affecting. So thank you so much, Dr. Jalang'o. And I hope that helps you, Linda. Yep.
Could I just add something?
Yes, please.
You mentioned something very important about taking several sugars. When you have several sugars, you are able to identify patterns. And you remember when we don't manage individual sugars, the patterns tell us a better story than a single sugar. So that is why having numerous blood glucose readings is better than just coming with a fasting or just one or just one postprandial sugar at the clinic. So thanks for that, Alice.
Okay. The sessions are interesting. The questions are many, but we also have the group to follow up. So at this moment, I'm going to give it back to Lydia. Thank you. Yes.
Well, thank you so much, our team, Dr. Ojwang and Ms. Jalang'o, for that insightful review. It's always interesting to see how each session builds on the previous one. So please, we remind you yet again, if you have not watched the previous sessions, kindly get in touch with us. We'll send you the links to all the sessions so that you catch up with the rest of us. But thank you so much for that part. So now we move to one of our main topics this evening, hypoglycemia and hyperglycemia. If you're living with diabetes, chances are you have experienced a low or a high blood sugar at some point. But the question is, what do we know? What do we need to do when this happens? So we are just about to find out. To take us through this important topic, Ms. Atieno Jalang'o, it's my pleasure to invite you. Welcome, please take it away.
Thank you so much, Lydia, and good evening once again. Today we are going to discuss hypo and hyper. These are extremes of one another when we look at glucose management. So it is very, very important today that you are able not only just to know, but to understand what each one is. So I'm going to start us off. Oh dear, I didn't start from the beginning. So we'll start off by a bit of a reminder. And the reminder will be around the control levels, you see? Because when we talk hypo or hyper, it's not just sugars either above 10 or below, let's say 4 or 3.9. Now, the issue is you need to always remember these levels. If your fastings are not falling between 3.5 to 5, say they are 7, they are 6, then you know the sugars are high. Okay? So it's important to always keep in mind these parameters. And then the other important thing is after 3 months, what are your levels at? Because hypo, hyper are the extremes, are at the extreme ends of good glycemic management. We want to avoid hyperglycemia, but our limit is hypoglycemia. So there is a critical balance that you have to keep while you are executing your self-care. For the purposes of this, I'll start with hyperglycemia. And hyperglycemia simply means high blood glucose. And what does this mean? High blood glucose, if your sugar level is more than 7.0 millimoles fasting or 11.1 millimoles random sugar, that is if you don't have diabetes, that's for diagnosis, or if you have diabetes, your HbA1c is greater than 7, okay? If you don't have diabetes, then 6.5% HbA1c diagnoses you as having diabetes. So for those who have diabetes, we are looking at fastings. If your blood sugar level, we don't want you going above 7. And then again, we don't want a HbA1c greater than or more than 7%. Why is hyperglycemia important? Because of the complications that it creates. And the thing with hyperglycemia, you often do not feel it creeping in. It's very, very subtle. It comes in slowly. And if you are not checking, you might be thinking you are okay, but you're already in great trouble. So it's usually unfortunate if you can't measure, but if you have a blood glucose monitor, measure all the time. Then causes of hyperglycemia. One, of course, at diagnosis, you can have the insufficient insulin production in type 1, insulin resistance in type 2, and then also regarding your intake, too much of carbohydrate intake will send you overboard. Lack of physical activity. And I was so glad when Dr. Langa gave his testimony as to his experience. Lack of physical activities will make your sugars go up. And the other things that also make your sugars go up are illness, infection, or stress. Certain medicines that you may need to take, some diuretics, some steroids, they can raise your sugers. And then, of course, some pregnancy is a diabetogenic state. So some people get their diabetes being noticed during pregnancy, and that diabetes diagnosed during pregnancy is gestational diabetes. But remember, you also have to have a predisposition so that the genes are there. Then because of the hormones of pregnancy, then it expresses, okay? So if you take your medication late, or you miss your medication, or you take too little, sometimes for some people, they titrate their medicine if they're living far and clinic date is not near and the medicine is about to finish. So instead of going, they titrate, and sometimes it's for economic reasons. Then, of course, if your medication is expired, and especially insulin or even the other medication, or you have improperly stored your insulin, then it gets denatured and will not work, and your sugars are likely to go up. So, what are the signs and symptoms? The mild symptoms can range from lack of concentration, frequent urination. Then you have a sweet and fruity breath, thirst, flushing of the skin. You go to the toilet often. And then, of course, blurred vision. Okay? Then, as the hypoglycemia worsens, then you get dry mouth, stomach cramps, vomiting, nausea. And as things get worse, you can even go into labored breathing, be semi or unconscious. You also get confusion and sometimes very profound weakness if you're not unconscious. So those are the signs and symptoms that can happen. You may not get all of them. You might get some, okay? So it's always important to be on the lookout. Now, why are we worried about high blood glucose? We are worried about high sugars because they are the one direct cause of complications. For every 1% HbA1c rise above 7, the higher the risk of diabetes-related complications. These range from problems in the brain, such as stroke, problems in your eyes. It can even cause cataract, glaucoma, and even blindness. The heart, you can even get cardiac arrest. Your teeth, you get disease of the gums and the roots of the teeth, dental caries, etc. Then you can have problems with your liver, problems with your kidney. You get problems to the vessels in your feet, and that predisposes you to diabetes foot damage. And then you also can have problems with your sexuality and also problems with your nerves. So it's important to balance things out and address hyperglycemia. Usually, if it's very high, usually be above 15 millimoles, you seek medical attention, and especially if you cannot trace what the cause is. Otherwise, you need to address the cause. If you're not exercising, then you need to exercise. If you're eating too much carbohydrate, you need to address that. Okay? If you're stressed, then you need to see a psychologist or a counselor to ensure that together you work out a plan on how to manage your stresses. So when we are managing either hypo or hyper, lifestyle modification is important. Your exercise, taking your medication, or whether it's insulin or oral or a combination of the both, checking your blood glucose regularly, adhering to your lifestyle management and your medication management, and of course taking the medicines as prescribed, and managing your stress levels. Now, when we go to hypoglycemia, by definition, hypo means low blood glucose, usually less than 3 millimoles. Symptoms must be consistent with low blood sugar, and the other thing is you get relief when the blood sugar is increased, meaning if you're given something that has glucose, then you feel better. Then we know you've had a hypo. However, there's also the false hypo. False hypo or pseudo hypoglycemia is symptoms of hypoglycemia in people with poorly controlled diabetes when the blood glucose declines rapidly towards the normal range. So let's say you have been averaging 15 millimoles and you get a decline of blood glucose rapidly towards around 10 millimoles or 9 millimoles, 8 or 7, then you will actually present with symptoms of hypoglycemia, and the body will react as if you are actually having a true hypoglycemia, and it must be treated as such. Now, for hypo, unlike hyperglycemia, the onset is usually very rapid, and sometimes you may not even notice the symptom. So what are the causes of hypoglycemia? Now, this can be the drugs you're taking, like insulin, your sulfonylureas. We'll discuss this later on in another session. Things like beta blockers for hypertension and the medicine for malaria, such as quinine. So it's important, like when you are taking these drugs, or even when you're admitted, let's say for malaria, it's important to let people know that you have diabetes. Then critical illnesses such as liver, kidney, or heart failure can also predispose you to hypoglycemia. And taking alcohol without food, then you are at high risk of hypoglycemia. And this is usually very critical. And it's one of the reasons why we do not recommend alcohol in people with diabetes. Why? Imagine you have a hypoglycemic attack and you have taken alcohol. Somebody who is coming to help you, they'll smell the alcohol, they'll leave you. They'll say, that one, leave them alone. And you usually will end up in the police cell, charged with causing a disturbance of the peace. And chances are that you will die in the cell. And that's how many people with diabetes who drink alcohol, and especially who get drunk, they often die in police cells. So we need to be very careful with that. Pancreatic tumors, especially the insulinomas, okay? They cause, they secrete insulin, and they can cause hypoglycemia. Then excessive exercise, skipping meals after taking medication, or you take your meal long after you took your medication, then that can cause a problem. Then hormonal deficiencies also can result in hypoglycemia. Now, what are the signs of hypo? One, the initial signs that you feel are your body recognizing that it is exposed to a threat. It is in relation to your body producing adrenaline. This is sweating, trembling, palpitations, the fast heart rate, anxiety, tiredness, hunger, nausea, and drowsiness. Now, as things get worse, then you get signs of the brain telling you that now it does not have enough glucose. And now your speech may be slurred, you may behave bizarrely, you have inability to concentrate, you can get headaches, you get irritable and full of rage, confusion, paralysis, etc. And it's also important to notice things like paralysis. Not everybody gets them. Some people also get twitching of the eyes. They are often called the unique signs of hypoglycemia. So it's important that when you have diabetes and you get something that you are not sure, you're experiencing a symptom you're not sure of, it would be good if you could test your blood sugar and see if it is related to the state of your blood sugar. Often there are issues with hypoglycemia. And because of these issues with irritability, rage, abnormal behavior, it is always important for you to have a bracelet or a necklace that has a note saying, I have diabetes. Because imagine in an office, if people even don't know you have diabetes, and then you go on a rage even to the boss, what would happen to you? Or if you're the boss yourself and you get into a rage to the employees, this can create a big problem. So it's important that people, at least one person or so should know at work that you have diabetes in case of such an event, because sometimes it may end up, you may end up being sent off from work. And if something also happens to you in, like, let's say a supermarket, and you do not have anything to show that you have diabetes, then it could be a big problem before help comes. So it's important to have a medical alert bracelet or a necklace or something on you that says you have diabetes in case hypo occurs. Now you can see all those things with hypo, even students daydreaming in class, dizzy, sweaty. You can even get seizures, moodiness, unconsciousness, depression. And the thing with hypo, why it is so dangerous and why you need to always take care with the sugars is because hypo can kill you much faster than hyperglycemia, than high blood glucose. So how do we treat hypoglycemia? We use the rule of 15 for mild to moderate hypoglycemia. So on this rule, the basis is 1, 15 minutes, 2, the amount of glucose that you take, which should be 15 grams. So if blood glucose is below 3.9 and the person has symptoms of hypoglycemia, that is shaking, sweaty, confusion, and dizzy, then we proceed to the next step. We consume 15 grams of fast-acting carbohydrate and take 15 grams of glucose or simple carbohydrates. And some examples are such as, the dextrosol, the glucose tablets. You can take 4 such tablets, or glucose gel. Glucose gel is already pre-packed. One tube, when you open it and you take the contents, that's enough to 15 grams of carbohydrate, of glucose. Then you can take half a cup of fruit juice or a regular soda. Please do not use diet soda or club soda for when you have hypoglycemia. You need sugar. So half a cup of fruit juice or regular soda, 1 tablespoon or 1 tablespoon of honey or sugar, or 6 hard candies. Like this mint that comes round like this. These are the lifesavers, okay? So those mints, if you can, the ones with the hole, you can take 6 to 8 of them. If you can't get that, then 3 tropical sweets or 3 swan sweets would help. Now, as we continue on the management, 1, you wait. You wait 15 minutes after you have done that, and you recheck your blood sugar. If the blood sugar is still below 3.9 millimoles, that is 70 milligrams per deciliter, then you repeat the process. Then you consume another 15 grams of carbohydrate and recheck after 15 minutes, okay? Then you repeat until the blood glucose is normal, okay? So if it has not normal, is above 70 milligrams per deciliter, okay? Then you eat a snack if the next meal is more than an hour away. So you would need to ensure that you eat a balanced snack, for example, a sandwich, which has some form of a fatty. So like, let's say some bread, half a sandwich with some peanut butter or some margarine. At least it has to have something that holds a protein or a fat, okay? That holds it together, okay? To prevent a recurrence. You don't want it to recur. So if you have severe hypoglycemia, okay, then glucagon injection needs to be administered, okay? And if you don't have glucagon injection, then the best thing usually is somebody will have to now help you. They need to put glucose between your teeth and your cheek, and put that side where they put the glucose should be on the side that lays you down. They put you on like the recovery position and seek medical assistance as an emergency very quickly. Now, for the long term, you may need adjustments to your medication. You may need to take more keenly your meal planning so that you are regular with your meals. You eat balanced meals. You are not late with your meals. And then also ensure that you monitor your blood glucose levels frequently. So the other important thing is hypoglycemia. You don't want frequent hypoglycemia because frequent hypoglycemia can damage your brain cells, okay? And therefore interfere with your memory and your functioning, okay? What are called your cognitive skills. Now, so we need to prevent hypo by what we are doing now today, the education on recognizing the early symptoms, maintaining a regular eating schedule, adjusting insulin or your medications appropriately. Often this sometimes may need support from your care provider if you are not already an expert patient. There are patients who get so well with this that they're able to adjust their medication. And then you need to monitor your blood sugar before and after physical activity. And then always remember, as a lifesaver, you must always have glucose tablets on you. You must. This is not an option. Or if you're traveling or going somewhere, also you may need snacks. Okay? So remember that. Now, the other thing is now bringing the issue about the balancing the hypos and the hypers. And this is very important because your HbA1c is important. A 7% HbA1c may mean many things. Now, look at this first person here, having very high, very low sugars, okay? But they have a HbA1c of 7. Now, there's this other one who doesn't have many hypos, but they have a significant amount of time that they are out of control. And then there's the person now who is truly in control, this third one. Now, the third one is 100% in range. This is the true 7%. Then this other one is having hyper, relatively not too high, but yeah, some very significant. So you can see 70% they're in range, 5% low, which is not too bad, and 25% high. But look at the HbA1c, 7. Now, then here, look at this. 40% in range, 40% high, and 20% low. This is so disruptive. So these two people will get complications, okay? Because the hypers are not taken care of. That is why this education is extremely important, and that is why when you have diabetes, monitoring severally is more important than just having one sugar. So if you don't have a continuous glucose monitor, it is important to do what is referred to as structured testing. So I think that ends it all. So in case of any questions, I'll be delighted to take them. Thank you very much. Lydia, you can take over from there.
Thank you, Dr. Jalang'o. Yeah,
Yes.
and just to emphasize, Lydia, just a second, just to emphasize that if you monitor your blood sugar very well and you do some of these things we are telling you, do people actually struggle with hypoglycemia at No?
No, they don't. If you see, if you take a lot of carbs, they raise your sugar high, and then especially if you're a type 2, then your sugars will come back down, falling down very fast. You rise high, fall down, rise high, fall down. And this is what creates a lot of problem. The yo-yo effect. It's called the yo-yo effect. Up, down, up, down, up, down. Extremely dangerous for your body cells. Will predispose you to a lot of diabetes-related complications. So what we have seen over the past 6 years in this program is we don't have a lot of hypos. Actually, when people start regulating the amount of carbs that they're taking, they're exercising regularly, and we adjust their medication in time, people are doing extremely well. Very few incidences of hypos. So don't be scared. Just start practicing what you can as soon as you can, and you will see the difference.
Actually, I've also seen that people always manage hypo with food. So when you start getting hypos, what are you supposed to do? Just as a repetition and emphasis, especially when you're changing your lifestyle and you start getting hypos, what do you do?
Yeah. Now, like let's say you have started changing your lifestyle, you're in, like, say, in this program now, and you start noticing that you are now having lower sugars. The thing that if you're on medication, we want to start adjusting your medications as soon as possible. So essentially, if you have a clinician that you're seeing, please kindly, you need to get them involved as fast as possible so that adjustments are done so that you don't start eating to keep up. Yeah. So as you're getting better and better in terms of your self-management, then we adjust your medication accordingly.
Yeah, thank you. So I have a question here. Maybe you can just answer it. I have a patient whose RBS ranges between 11.9, so let's say 12 to 16. It's in this range for patient has been in care for more than 10 years. What can you say about that?
Wow, that is chronic hyperglycemia, meaning they have been in a high blood sugar out of control for such a long time. That patient is at high risk for diabetes complications. They need to be here like yesterday. Unfortunately,
my
they're locked
answer.
out. But this is actually the patient who really needs this program because they need to make the lifestyle changes as fast as possible. And then we also need to look at their medication, whether they are not or not they are on medication, what they are, and assess as the lifestyle is being changed,
Yeah. And yeah, we've had many people who had higher blood sugars. And after week 3 or week 4 carbohydrate intelligence, they start getting hypos. By week 6, dosages is reduced. By week 8, they're in remission. It is not difficult to manage this patient better. Yeah. So one more piece. Kung Pei, please go ahead. I hope I tried to pronounce your name.
It is Kumpe.
Okay, go ahead.
So I have a patient who monitors his blood sugar daily at home. He monitors, and when he checks at home, he gets 5.145. I think the highest he has got is 5.5. But when he does the HbA1c, he sees 6.1, which is like slightly elevated. And I've not been able to understand what is happening with him. Can you help me?
He's doing super well. HbA1c of 6.1 is too good. It's actually too good. That person is probably at risk of hypo. The other thing is when you are in super good control, the body ceases to recognize hypoglycemia. Now, peace for your patient, he's at highest risk of getting hypo without being aware. Okay? So we would need to slightly just adjust his medication. But he's not in hyper for sure. He's not in hyperglycemia. We want your HbA1c less than 7. Usually we say very, very good is 6.5. So this patient is really doing very well. Yeah. The only danger now is hypo unawareness. When your control gets too good, your body cannot recognize hypo quickly. So the problem is you can all of a sudden just become unconscious and people are wondering what's happening. and it's hypoglycemia.
Yes,
Okay.
and usually if a patient has a HbA1c of 6.1 for, maybe 3 to 6 months, it means they're in remission for type 2 diabetes and they're not supposed to be on medication. So, yeah. Okay, thank you very much. We must go on to the next session. Is there any other burning question? For Immaculate, we say this patient with chronic hyperglycemia, as Dr. says, please invite them to join the program. Don't keep this program from people because it's a free season. And you see people who have been here season 7 telling you how they've benefited. So please share with your family and friends. Do not share the Zoom link, share the YouTube so that they can get all those sessions and follow. Thank you very much.
Okay. Please, I have another question about the carbohydrate intelligence. So now I've understood that rice and beans are equal, right, when it comes to carbohydrates. So how about when you have, in some part of Africa, we have rice and beans cooked together. So how should the portion be like? What would you recommend when someone is eating rice and beans?
That's the next session, portion size. So if we stop asking questions, we will get to that session very quickly. Yes. Okay. So Dr. Jalang'o, you'll answer a question here. It's on the chat. I think we can answer it on the chat. So we can go on to the next session and thank you so much. Yep.
All right. Well, thank you. Thank you so much, Ms. Jalang'o, for that clear presentation. You've helped us understand not only the difference between hypoglycemia and hyperglycemia, but to recognize the warning signs and respond appropriately. We truly, truly appreciate that presentation. So let's get ready for the sweet ending to this amazing session, our food portion. Actually, the theme is food portion control. So our registered dietitian, Dr. Ojwang, is ready to take us through. Please pay attention. Welcome, Dr. Ojwang.
I thought you had a video to share. Okay, so we decided to be practical. So we actually recorded a video on portions and then we can take the questions. Thank you, Lydia. Please go ahead.
All right.
Today, I've decided to actually show you how to serve the food practically. Remember, portion control is so important if you're managing your diabetes, you're managing your weight, and just making sure that you're getting sufficient nutrients. And remember, you should never ever starve. So if you get portions and you're feeling hungry before it's time for a meal, then you know you're eating too little. So we're just gonna try here. So here I have food. I have some chicken, some vegetables, and some mashed potatoes, and some steak. So I'm going to do portions for women, then I'm going to do portions for men. So I also have cup measurements, which sometimes we use. And why you use this is so that you can have a good picture of the portion. So you don't have to use it for a year. Use it for 2 weeks or 1 week and you know exactly the portion. But you don't even need to get measuring cups. We can also use these ladles. You see, like this ladle is actually equivalent to half a cup. So when we put starch, half a cup, it's equivalent. Okay? So let's try with the ladle. So I have my spoon here. So I'm going to serve some starch first. Okay? So that is equivalent to half a cup. Okay? So 1 ladle. So I'll place it there nicely. Then I'll come here and take my vegetables. So I made some lightly cooked carrot and cauliflower. So that's half a cup. So that is just, yeah, but vegetables you're supposed to have more. So you're supposed to have at least a minimum of a cup. So you can see that is a cup of vegetables. You can see this is already a lot of food. Okay? So then, what do you want to eat? I have chicken and I have steak. So why don't I put the steak here? Right? So here is some steak. Okay, and really we never really need to measure the stick. What we really want to measure is the carbohydrate. So if you look at this plate, okay, this is a friendly plate for a female, even or male. Okay, so this is friendly plate. So if you want it for male, then we want to increase the amount of starch. So then let's go back and increase the amount of starch. So I'm going to add some more mashed potatoes so that they're having a cup of starch. And surely, if you look at this food, it's enough. Okay? It's really enough for a man. So you can see there's always more vegetables, there's a bit of starch, and there's some protein. And for men, they can happily add a piece of protein. Okay? So that would be sufficient for a man. Alright? And so you can eat like this for breakfast, you can eat like this for lunch, but for dinner, you want to remove the protein from your plate. Alright? And remove the protein from your plate, and you want to have more vegetables for dinner. So you can add. You don't add. This is not going to be enough. So what you need to do, you need to learn to eat like avocado, coconut, and also a lot of groundnuts. Because you know, if you have a lot of protein at night, the amino acid in the protein increases your glomerular filtration rate. So that means your kidneys are working harder, your blood pressure is high at night. And so because we want to prevent you from getting blood pressure, and those who already have blood pressure, we want you to control it. You want to avoid animal protein at night. Now we've seen that you can have you can have mashed potato, you can have rice, you can have any starches you want, and also this place can actually have a fruit. So we are going to put bananas just now, but other forms of maize can be like this, you know. And by the way, both of you are male and female can eat a whole corn, because this is not even, this is probably a half a cup of starch. It is not. So you can eat like this. You measure your vegetables, okay, and occasionally, and of course you have your piece of protein there, okay, you can have your steak there. So let's put back this steak. You have your steak. This is a lot of food, and you find a man will fit nicely. The female may need to. And the other trick that you don't know, the other trick I want to show you is when you eat, start with your vegetables, then eat your protein, then eat your carbs. You will find that you will manage the amount of carb you're eating. And so today I feel like a treat. Sometimes you feel like eating a piece of cake, you feel like eating. So don't eat all your starches like this, then you go and eat your cake. Plan wisely. Like today, I can say I want to eat some cookies. So then the cookies is what I'm going to have here. And I like my chocolate chip cookie. So I'll eat my vegetables, I'll eat my cookies, and this would be my breakfast, okay? But this should be eaten occasionally, and the portions still matter. And sometimes we just eat badly. This is a bad example, okay? So let's say you come, you're feeling hungry, you serve a lot of starch. So let's say it is waru, okay? You see, that's just half a cup. That's already a lot. But you can come and you put that. Then most of the time what we do, we come and we put very little vegetables. Then maybe you're having your meat, a piece of steak. That's fine. And then again you come and you put some maize. Okay? Then you want to eat some cookies. Then you come and now have fruit after that. Surely, this, you're never going to lose weight. You're never going to lose weight. Your blood sugars will always be high. The medication you're taking, the dosage will always be high. And your diabetes will only get worse. Your blood pressure will only get worse. So remember, you cannot eat 3 carbs in one meal or 2 carbs carbs in a meal. So you need to choose, what carb am I going to have in my meal? Is it going to be the potatoes? Is it going to be the corn? Is it going to be the fruit? Or is it going to be cookies? Remember, cookies are occasional, but you need to decide which carb you're having. So you can have a piece of steak, okay? So you decide, I'm going to have an apple. So let's remove that from the plate. Let's remove the corn from the plate. And let's get rid of the cookies. So you can decide, my breakfast is going to be a fruit. Okay? Then, and I'm going to have recommended amount of vegetables. So I'm going to have more vegetables here. That's about a cup of vegetables. This is a good meal for breakfast. For men, you can have even 2 apples at most. Then you can add your protein. And whenever you're hungry, you want to start by adding the vegetables, the protein. Carb will always be the last to be added. Okay? So you want to, so that would be a man portion. Female portion, let's reduce the protein and let's remove one of this. Remember, men are vascular, they need more food, but females can eat like this. So what do you think, nice people? And you just learn. Keep learning how to do your portions. If you eat like this, you're not going to be hungry. Unless you're a marathon runner or you lift weights. Then when you eat like this, probably you'll be hungry at 12 or 1. Then eat lunch. And keep the main portion. You always want to maintain a good portion of vegetables, a good quantities of protein, and this. And of course, today this is the example we show. But next week we're going to show you how to note what to eat, what other things to eat. And even now we're going to show you how you can use a salad to your advantage. I'm making my dinner now. So I'm going to have a salad tonight. So I'm gonna have some cucumber with tomato and avocado. And maybe I have an option of adding almonds. So let me make my dinner and then be right back. So here I am, I've cut my salad. So my salad, I've got some cucumber, I've got some tomatoes, I've got some almonds, and I have avocado. This is a high calorie diet because of avocado and the nuts. The nuts have fat and protein, very little carb. The avocado is very high in fat. So this is a very good meal and it will last you the whole night. See, there's no meat, there's no what. It's full of nutrients, full of phytochemicals, okay? So it's good to eat it like this. You can also add, you can cut it into smaller pieces, mix it up, add some oil, dressing, put some salt and pepper, whatever you want, you can do that. Or if you're really feeling hungry and you need something, you can have a banana with it. Just add a banana to this meal if you want. But already I think this is enough female portion. And if you're a man and you're very muscular, then you have an option to add some more almonds or groundnuts or any protein, vegetable proteins that are available to you. Surely, let's eat some more vegetables in our diet. So I want to see a healthy dinner. Imagine you are going to rest. When you're sleeping at night, your body rejuvenates, it repairs. Would it be best to eat this at night or some overcooked vegetables and meat? This would be the best option. Your body will be happy. This is too much for me. I don't think I'll finish the avocado. Even I think this is a lot. So I left some avocado. Also, if you make the salad early and you're waiting for the family, you can always just leave the seed there. Your avocado will not change color. And for men, you can have this is a full avocado for men. For women, you have to limit your portions. You're muscular, you always need a little more. You're not muscular, you need a little less. So remember, thy food is thy medicine, and thy medicine is thy food. Yeah, I think we tried, Lydia, don't you think so? To record, we are amateurs. So I will Atino.
Yeah, that was good, Alice.
That was good. So I'm just gonna end it up with a slide, okay? Then you can post your question there. And we just want you to take things easy. Don't be stressed out. How do I measure my portions? Just take it easy. Use the spoon, use the plate, increase the vegetables, reduce the carbohydrates, just look at your plate. What do you think? Some of these things don't have to be academic. Yeah, okay, here we go. Just 2 slides to emphasize that. So remember, taking drugs without eating properly is like washing your hands and drying them in the dirt. And also, one of the quotes that I like to use is, to lengthen thy lives, lessen thy meals. Yeah? Yes. So portion control is extremely important. It's a practice of just managing and regulating. And we've already given you a method, use the spoons, use the measurements. Most of the time we eat until we sweat, until we want to remove the baton. That is, your body tells you when you're full. So when you're full, stop, yeah. So it's understanding appropriate serving sizes for different foods to meet your nutrients, you get. Why? It's good to be aware, be mindful of how much food is on your plate and how it aligns with your dietary requirements. We shouldn't eat a lot. We should eat just enough. We need to have a balance to ensure portions reflect a balanced intake of nutrients, including proteins, carbohydrates, fast fiber. So when you look at your plates, now that you're posting your plates, go back and look at them, the ones you posted, whether they are 10 or 20. What is the picture you see? Are you eating some raw vegetables? Just evaluate it. But next week's session is about an ideal meal. So for now, let's concentrate on the portions, okay? And also moderation, avoiding excessive quantities of calorie-dense foods while ensuring sufficient portions of nutrient foods, yeah? So why do we need to portion our food? Prevent overeating, promote a balanced diet, manage your weight, improve digestion, stabilize blood sugars, reduce food waste, because we also can waste a lot of food, support long-term health, meet your energy requirements, and to be realistic and sustainable. So you shouldn't eat. So we're going to, oh, I was not supposed to do this. So we just looked at some portions here, but yeah, this is the one I wanted to show you. So usually, during the sessions, these are some of this is not for this season, this is for last season, but I had to take it. But what I wanted to show you is somebody actually sits down and eats like 4 bananas, on matoke, or they eat this much potatoes. And this was genuinely somebody's portions. They posted, this is what I had, and then they go. So this is not balanced. That's on the higher side. So this is one of the portion sizes. Always remember, half of your plate should be vegetables, and your plate is always the diameter of your thumb and your index finger. Okay, so when you're taller, you need a bigger plate compared to a shorter person. So you can eat like that. You can start making your food like that, okay? And also, I will post this in the group so that you can use the measurements for women and measurements for men. And it's just a guide. So you can use that, you can use the plates, and so it gives you measurements for men, what you should have initially, and then also what is important, the portion sliding, So remember, always when you've measured your first portion, you want to increase with vegetables, then increase healthy sources of protein, then you put nuts and seed before even you add carbohydrates. So thank you very much. Yes, remember, you don't need all that now, just portion, okay? So you can't control everything in your life, but you can control what you put in your body. So quantities, yeah? So the challenge is measure your food. You can use the plate method or what you've seen in the photograph. Thank you very much.
All right. Well, thank you so much. That was such a treat. I think many of our questions have actually been answered, but if we still have some more, we have the group. Feel free to post them there. The doctors will answer as we go on. So thank you so much. Dr. Ojwang, we have a few questions in the chat. Could we take about 2
Yep.
minutes? We need to conclude.
Yes, that's
Sure.
right. Mm-hmm. So please read the question. I don't know which one is it.
You're right. Nemali has been answering some. All right, Nemali. Yeah,
Okay,
so
I don't see any questions. So do we have any questions? Somebody raise their hand and ask one question. So we call it a day. Nimali, you had a question or a comment? Okay.
No, I don't have any question, although I can say even as before we've done the portion section for this week, already some of the participants in the last week session alongside carbohydrate intelligence, you could say that some of the carbohydrate portions are well reduced, more vegetables are included. So the plate method, some of them are actually just doing it without this knowledge. So I hope this week we will actually implement the knowledge and keep posting more of our photos. But the session was quite good. The session was really, really interesting. Yeah, thank you.
Yeah, and it's true. Thank you for mentioning that. People, I mean, from the first weeks to now, people have really changed how they eat already. So they've already reduced the portions, reduced the carbs. I was seeing carb intel, a cookie, small portion of strawberry, lots of vegetables, Yeah, so well done. Well done, everybody. We are so proud of you. And this is just the beginning. Yeah. Okay, we leave it to you, Lydia, to end. And yeah.
All right. Well, thank you so much. So as we close, we'd like to leave you with these words. Your next meal is your next opportunity to care for your health. We look forward to hearing about your experiences in our WhatsApp platform. I believe that quote summarizes what we have learned this evening. Managing diabetes is not about being perfect. It's about making better choices, one meal at a time, one portion, one day at a time. We have the challenge of the week. It's time to put it into practice. As you prepare your meals, think about your portions. Pay attention to how your body responds. If you experience symptoms of low or high blood sugar, remember what you have learned today and act promptly. Thank you so much, Dr. Alice Ojwang, Mr. Tieno Jalang'o, the nutrition team for another informative and practical session. We also thank each and every one of you for your time, your questions, your participation, your commitment to improving your health. So today's session has been helpful. Please share this YouTube channel with someone who could benefit from the knowledge we are getting here. And then together we can help more people gain mastery over diabetes through lifestyle change. So we wish you a wonderful week ahead. Keep sharing your meal photos, your progress, and your questions in the group. We love seeing and sharing in your journey. So wherever you're joining us from, thank you for spending your time with us this evening, and we look forward to seeing you again next week on Monday. Until then, take care. Bye-bye.